Hello and welcome to this edition of Community Voices Uganda on Civic Space TV. I am Phillip, Muliisa. You're very welcome to this conversation, and it's such an honor having you all here to have a conversation about matters pertinent and very important to our beautiful country, Uganda, but also the world at large. And today, specific, we are talking about the quality of primary health care in the country and what that means for the citizens, for the peoples of this country, but also extending it to the region and the continent, and indeed how we can be better and good living citizens of the world. I am Phillip, and I'm joined by a panel of very distinguished citizens of this beautiful country, whom I will try to introduce, but also give them a minute to talk to us about a bit of themselves and where they are and how actually they are seeing the seasons changing and how it is playing out in your particular locations. I'll start with Madam Brenda Nakanwangi. She is a Senior Programs Officer, Community Health Department at the Ministry of Health, Uganda. Brenda, greetings. You're most welcome to the conversation.
Thank you so much, Phil, and I'm happy to be here. Yes, my name is Brenda Nakanwangi, and I serve with the Ministry of Health under the Community Health Department. I'm happy to be part of the conversation.
Thank you so much, Brenda. We're happy to have you, and we can't wait to hear what you have to share with us as regards to primary health care and how things are playing out at the ministry, but also what the ministry is looking at doing to make sure things keep getting better and better for the citizen of this country. Thank you so much. I'll go to Mr. Goodluck Jonathan. He is a journalist and a very passionate Ugandan. Mr. Goodluck, greetings. You most welcome to the conversation.
Thank you very much. I'm happy and glad to be back on the civic space, a forum where we have an opportunity to share out there. Indeed, I can see you're putting on, indeed we are in winter. It's always an opportunity really to give a word here and there to make our country better. Thank you.
Thank you so much. Good luck. We're happy to have you, and surely we shall have a good conversation with you. And yes, Dr. Christian Musana. Doctor, greetings. You're most welcome to the conversation.
Thank you very much. This is Dr. Musana Christian. I work with CIRAD Uganda, as well as BIONET Medical Center. I'm well excited to join this platform today, and I'm willing and wishing to learn more as I share also what I have regarding our PHC system in Uganda. Thank you very much.
Thank you so much. And just now we've been joined by Wachi Nasulu, the Deputy Mayor, Northern Division, Mbale City. Nasulu, greetings. You're most welcome to the conversation of health and well-being by focusing on people's needs, early care to any medical concerns, paying attention to the determinants of health, and conclusively whole person care through their lifespan. And this is a very long statement. When I read it through, I went it and I'm like, this is very powerful. And bringing it to the Ugandan context, I want to understand when we talk about whole of society approach to healthcare. I should start with you, Brenda. How would you, in simpler terms and briefly, define the status of primary health care in this beautiful country, Uganda? Yes, Brenda.
Thank you so much, Phil. Let me start with this note that when we talk about primary health care in Uganda, we talk about the ability to ensure the highest possible health and well-being of the citizens of Uganda. Of course, focusing on what the needs, the health needs that they have, and also the other arm of making sure that we meet the health needs of the people and make it accessible to be able to prevent disease, promote health, treat, and rehabilitate where possible. So still when we talk about the status, I want to also make this note that for Uganda as Uganda, we prioritize health and service delivery through 2 different platforms. And our primary healthcare is 2 different platforms. We have the facility platform, and then we have the community platform. In this way, we want to make sure that every Ugandan accesses health and every Ugandan can be able to receive what they need in order to be productive as a citizen. So the way the status is right now for the facility, the Ministry of Health, I can say if we are to compare ourselves, really, we're almost at 80. We appreciate that there are those that are still not really going well, but majority of the things have been put in place. For example, at facility, we have now facilities where people can receive curative, promotion, and some of preventive interventions from the lowest level possible. We have what we call Health Center 1, a Health Center 1 at the village, whom we call the VHTs, the village health teams. Yeah, they are it's Health Center 1s. And then we have Health Center 2s at parish level, literally at every parish. And the beauty is that all these health centers are now being upgraded to become health center 3s, simply because we want to be able to have clear services or even more services. Remember, the lower the health facility, the less the services because of the staffing norms that govern that facility. But when you go at sub-county level, in every sub-county, there is a facility at the level of a health center 3. Then we have a health center 4. We have a district hospital. A health center 4 now, it's even being called, it's being developed into a community hospital, that it can to have a doctor to manage all community issues. Then we have a district hospital. Then we have regional referral hospitals, different from many years, where we used to have people from all over the country being ferried to Kampala to go to Mulago. Now at least every region has a regional referral hospital, to the extent that if you go to any region, if you go to Lira, all the services that you would have got from Mulago, you can go get them from Lira Regional Referral Hospital. And basically that means that services have been brought close to the people, but also we do not have to lose people on the road finding services in particular locations, but the whole of the country will be able to, people can be able to access services close to them. And then we have, but also the general hospitals are center of excellency. And then we have the national hospital, which we expect that only cases that cannot be handled in regional hospital can be taken to the national hospital. So that's the facility. And we have special, as we have special clinics within those facilities. When you enter a facility, you find an orthopedic clinic, you find an eye clinic, you find a clinic for OPD clinics, you find a PD clinic, and all those are clinics with special and highly technical doctors that man them. And that's how good the health system is. And then we have the other arm, which is called the community health system, the service delivery. For community, of course, as the Ministry of Health appreciated that we have very good hospitals, but we appreciate the status of the citizens that we serve. That for us as the government, as the ministry, we want to see every Ugandan healthy and productive. And so the ministry went ahead to strengthen the community, where we take services close to the people from the facility to their homes, inside their homes, inside the schools, inside the markets, where they spend the rest of the day. Of course, appreciating that a lay Ugandan sometimes finds it difficult to leave work, because some people just work and they have just enough for them to survive a day. So a day without work, that means a day that that day they may not be able maybe to eat, they may not be able to make enough saving, which would have compensated for their rent and so much more. So as the Ministry of Health, we opted to strengthen the community service delivery platform. We put cadres at that level. We have the VHTs, we have the community health extension workers, and these are made to take services to the community. They test in the community. They manage cases like malaria, pneumonia, diarrhea, first aid in the community, immunization, where we used to wait for people to come to the facility to bring their children for vaccination. Now, literally, nurses get out of the facility and go to communities, trading centers. You've seen them in trading center, in local local clinics, in places of convenience, just to allow people to come and access services. We have other structures within the local government, the health assistants. You see people cleaning roads every day. You see people washing up public toilets every day. When you go to the market, you find it clean. When you go to the tax park, you find it clean. When you drive on the street in the morning, you find it clean. It's another arm of health that people don't know actually it's health, that makes sure that people live in places that are clean and hygienic for them to be able to be healthy and productive. And that's how the status of the health is. And as you see that as time goes on, when we introduced the community arm and we strengthened it, we've seen indicators around mothers delivering in facilities, babies that the number of babies that are lost before 5 years reducing, the number of unwanted pregnancies reducing. We've seen people dying of preventable diseases reducing, and so much more. And probably we are seeing the other arm of diseases that are caused by lifestyle, like diabetes, hypertension. They are the ones that are on the rise. But diseases that can be prevented are actually reducing because of the way the Ministry of Health has come out with different innovation to make sure that the citizens receive services.
Thank you so much, Brenda. You can hear me?
Yes, I can hear you.
Thank you so much. That's a very powerful and beautiful image. You talked to us about the status of primary health care in this country and painting a picture of the two arms in terms of the facility arm and the community arm. It paints a very, very powerful picture and something many people can relate to in our communities, but also trying to build on in what we experience at individual level. Thank you so much. I want to come to you, Mr. Musinguzi. Look, you heard from Brenda. When she talks about all these things the ministry has put in place, including health center facilities from health center 1 to health center 4 and having upgrades and having regional hospitals to the national hospital here in Mulago National Referral Hospital. Are these the same messages you pick from the community because you deal with information, you deal with picking and disseminating information to the public, but also hearing their cry or hearing their happiness screaming out of the communities? Would you say this is a clear picture that is present in the communities where you are, but also extending to the country at large? Yes, Goodluck.
Thank you very much. And thank you, Brenda Nakanwangi, for shedding that light. What is true about Ugandans is that maybe, and I thank you for really adding on this voice, because we are in a space as if nothing is happening, yet she has talked of all these structures. Now, if you saw what happened in Kampala with the floods, the overwhelm of the floods of the drainage system, that's when you hear Ugandans coming up and saying, hey, you mean nothing is being done, and all sorts of opinions. Now, because in the health sector, we have not seen that, the overwhelming of the system. That's why I would partly believe what Nakanwangi has said, that there is something being done by so many people out there. And maybe sometimes we don't appreciate them. And for me, maybe I see the difference in towns and in the villages. For example, in Kampala here, it's hard for me to know where my village health team person is. Because I mean, recently I saw a video, even where Nakanwangi was, and somebody was saying, you know, people in Kampala, we don't want open gates. We, you know, when something happens, you have your money, you rush to a pharmacy, a clinic, and sometimes maybe you are using even social media and you say nothing is happening. But to those who are dealing with some of these situations, they know that a lot is being done. Now, when you go up country, especially, I remember I was in Kisoro, and I was at the border, and one of the things I saw was when somebody was asking for a visa, because, you know, at that time I think Congolese were still paying $50 to come into our country, and one of the things the family was being asked why they are coming to Uganda, they said they were going to Mulago to access services for a chronic disease, that they can't fly over to Kinshasa, which is so many kilometers away from them, and they felt that Uganda was the nearest. So even when you go to the refugee camps, the refugee settlements, you find that we get overwhelmed, but still the system is that resilient. And therefore, it is true that something is being done, but of course the mind or the heart or the human being will say, we need more, we need more. And also incidentally is that 70 to 75% of the diseases can be sorted at the community. When you go to our homes and we can wash our hands after using the toilet, what kind of toilet are you using? And that one, the enforcement has to be done by the parish chief and all these other authorities. That we even with these rains, that we can't have things like cholera hitting us. I don't know when the last time we were hit by cholera. So you can see how we're able to detect Ebola, monkeypox, and all these sorts of things. And recently I was in Lira, where she's talking about they opened up a satellite laboratory that is compared to the one we have in Butabika, here built by the Americans. Actually, we have 3 in Africa, 1 in Egypt, 1 in Uganda, 1 in South Africa, state of the art. But now we have started having a replica of some of these things, infrastructure at the regional level. Now, once the doctor comes on, he will tell you that without even good laboratory services, where do you start from? If I come and I say, you see, my legs are swollen, I am like this, maybe you need to do a urinalysis to know whether my internal organs, maybe I have kidney disease. How will you know? So we have gone a long way, but for me, I would ask Brenda, Nakanwangi, and every other person that we need to amplify the voice of telling people so that they're able to know some of these services. Because you go to some communities and they'll just say, and you know they have the right, they'll just say, we don't see what government is doing. There are also those voices. But I can tell you that by the fact that we have not been overwhelmed, I think for me, that's where you feel that what she has said is working. Thank you very much.
Thank you. Thank you so much. Good luck. And it's very good that we have complementary communication in terms of what Brenda told us, but also what you pick up from the communities. And it's very important when you talk about the fact that most of these challenges we experience as individuals can be worked on at community level. And when you look at the ministry trying to do what she called the community arm of PHC in this country, then we have something we are doing, and hopefully it's going to work out for the better of the peoples of this beautiful country, Uganda. Dr. Christian Musana, I want to hear from you. Firstly, take me to the health facilities as a medical doctor and talk about inside there, do we have what it takes to cater for the needs of health as a country in terms of the preventive she mentioned that today the cases we are seeing on a rise is things to do with lifestyle. And what is the status in terms of responding to some of these challenges that are emerging, but also those that are existent in our communities? And in any case, we always hear a question of patient to doctor ratio. How is it like, and what is the experience? Yes, Dr. Musana.
Thank you very much, Muliisa. And previous speakers, Brenda and Goodluck, thank you very much for your input. I would like to comment about the PHC system of Uganda, firstly. Yes, Brenda talked about the different levels. That's health center 1, 2, 3, 4. Then you go to the general hospitals and then the referral national hospital. Let me start with the health center 1 level. That is the community level VHTs. Yes, under community, the Ministry of Health has done its work. That's a credit to them. But I, as an individual, good enough, I work under an NGO. I happen to interface with most of these VHTs on ground. The Ministry of Health has done a great job in recruiting VHTs, but the challenge remains. You've put up in videos, but I following up on them. 1, that's the first question. 2, how motivated are they? Because I've met most of these VHTs. They're well equipped with some knowledge, more so when it comes to preventative measures, maybe let me say HIV, dysentery, cholera. They know these things. They've been well educated into them. But then they're retaining the knowledge unto themselves, not passing it on to the community, like what they're meant to do, because that's their role. But why are they doing this? 1 is motivation. They are complaining about stipends. Yes, the minister has enrolled them, has sent them to the communities, but they're not being motivated to carry out their jobs. That's 1 thing. Then secondly, I'll jump onto the facility level. That's health center 2, 3, and above. My first question was, why would Mulago be flooded with cases of malaria? Yet they can be dealt with at lower levels, health center 2, 3, and 4. You expect Mulago to have cases which are well much advanced, not cases like malaria, someone coming in with dysentery, someone coming in with typhoid. These fast diseases. These are cases which are meant to be managed at lower levels. So literally, I'm having a patient who is having a systemic condition, let me say a heart condition. Let me try to minimize medical terms here. So let me say heart condition. But this patient is failing to get urgent need or urgent care because there is someone else in line, someone else with malaria, simple malaria, who's into this line already into the doctor's room. So yeah, the levels are there, but we are not practically enabling our people into the communities to use them. Someone will look at health center 2 and take it as a minor health center, but literally all these are medics who are trained through schools, who have that knowledge of handling such conditions like malaria, typhoid. So what should we do? Number 1, I think the ministry should go back to ground and empower these other facilities, most of the lower level facilities, health center 2, health center 3. Let people stop undermining these facilities because these are fellow medics. They have the knowledge to handle this. So go back to ground, go back on table, find a way of empowering these facilities. If it needs help educating, passing on information to communities, teaching them through radio stations, through televisions, the importance of these health centers 2 and 3s. Then people also appreciate the medics out there. But also on the other way around, yes, they're there, but they're lacking major diagnostic tools. The Fund Health Center 2 is lacking a microscope. They're dependent onto strips. Why? Because under Health Center 2, you're only seeing an enrolled nurse and a midwife, maybe some support staff. Why don't we enroll maybe like a laboratory person to help out with this other stuff, to run microscopies. So this will still aid to reduce on the numbers onto some other higher levels and reduce on some cases, like I'll continue relating to malaria and typhoid because these are some of the things that people know the most. So it will help us reduce on these numbers onto the higher levels. Let us have more advanced conditions being managed at these higher levels rather than these other small conditions, unless it's a complication
So
coming
in
up.
other words, Dr. Wachi, in other words, what you are saying is most of these lower levels, health center 1, 2, 3, do not have enough equipment to do what they're supposed to do in the communities to which they are placed. Is that what you're saying?
Exactly. So we need more equipment, we need more empowerment. That is my first point.
And let's speak about the medical personnel themselves. Are they there and are they enough?
When you talk about, thank you very much. You talked about the doctor-patient ratio, firstly. Literally, with the late stats, we are having a doctor-patient ratio at 1 to 25,000. Let me put this picture onto you.
Dr. Musana, for emphasis,
yes,
please say that again. 1 to
25,000. So are you getting
what's
me with
the
that?
idea?
So we have an ideal of literally, according to the declarations, at least of 1 to 2,000. That would make more sense. But you're seeing this exponential rise of 1 to 25,000, and they're relating to the shortage of staff in facilities. But we are seeing almost each and every year we're having people graduate from schools. So having people out there into communities, medics, doctors coming out and are crying about not having jobs, but also out there into facilities also crying about not having enough doctors. So what is happening into our system? But still, I'll blame this onto the government, not even the Ministry of Health, because under the Abuja Declaration that we had, there was a consensus of having at least 15% of a national budget going into health. But if you look into our previous financial year, the ministry is being provided by 7.7% of the finances. So this is creating already a loophole into the health facilities. Healthcare system is failing because of this percentage. So you asked me about the clientele patient health worker ratio.
Please, as you conclude, sir.
We have, yes, we have health workers into these facilities, but there are not enough to help handle these clients. Because if you look at the health center 2, it is meant to handle at least 5,000 people. 5,000 people. If you go to health center 3, we have an estimation of 20,000 people that have to be handled. But imagine going into a facility and you're finding 1 midwife, 1 nurse. That's health center 2. And they're meant to deal with 5,000 people. And of which even this 1, 2, at times they won't come to work. If they come, they will come and then they'll leave off at maybe midday. By 11, they are off work. By midday, they're off work. When they're already off work. So it won't make sense. Yes, so in summary, we are having the PH system is in place, but we need to go back on ground and follow up on it.
Thank you so much,
you
Dr. Christian Musana, for your thoughts and very powerful issues you raise out there that are subject to more discussion and conversation, but also improvement as we move forward as a country. I want to hear from the mayor. Mayor, talk to me. When you stand and sit in Mbale, how is the situation like in Mbale? Are the medical facilities functional? Do you have medical personnel there? People responding to these institutions set up by government? Is the funding there? Briefly take me through the situation in Mbale and how you are managing to provide this service to the people of Mbale. Yes, Mr. Nasulu.
Thank you, Mr. Phillip, for the opportunity granted. I'm sorry I got a bit late. So let me take this opportunity to introduce myself to colleagues. Wachi Nasulu is my name, the Deputy Mayor of Northern State Division. And I want to first appreciate the topic that you have come up with. The fact is that this is a reality that we need to address and maybe see some improvement. When you look at PHC, indeed, when you look at the components and the agenda and the objective, is quite very good. And if we have to implement it quite to the expectation, then we could see more better results. But as far as Mbale is concerned, when you look at the domains of the program, it is still lacking. Because when you look at their major emphasis about health education, nutritional promotions, safety and sanitation, then maternal and health care. As just my previous colleague has just said, when you look at the facilities that we have, there is a lot lacking. Because we have these health center 2s, health center 3s, and health center 4s. But when you go to these health center 2s, they look to be someone who's home really. You find there 1 to 2, not even more than 5
and maybe
workers.
Mr. Nasulu, if you allow me just a
Yes.
second, are you able to have your video on? It's important, and everyone, if we are able to have our videos on, please, let's have them. Thank you. Please continue.
See why is still lacking? When you go to health center 2s, you may find that there are over 2 to 3 workers. But then look at the community itself. Needs actually even to upgrade to a standard of health center 3, such that maybe they can be in position to get able services. When you get to also even the health center 3s, the human resource is not there. Now, for instance, to get a dentist, I have like some 4 health centers in my division, but there's only one dentist. Attending to a population of around 30,000 people. And this person comes once in a week. So just imagine if we have more clients on the desk waiting for it, because when you're going to have a teeth problem, it can't wait for him to be there or to come before it touches you. Then the maternal services, when you also look at the midwife, they are not enough. So you find that referrals are referrals. And some cases that would be handled at lower health services are even pushed to referral hospitals where there is congestion. Take an example, the referral hospital that we have in Mbale. You find that it is covering more than 20 districts from within. So if they are to attend to all these districts, so just imagine these lower cases of issues, or as my colleague just said, malaria, typhoid, it wouldn't be in a referral hospital, but because there is no accessibility. Then the other challenge that we also have, we have the problem of infrastructures. We also that's a very big challenge in that some areas now, like now where it is raining, some people cannot even easily access to these places. Just imagine the mothers, the pregnant mothers. In 2 years, I think 2 or last year, there is a video that went viral when the DPC by then of Mbale State rescued the pregnant mother using his means to help her go and deliver. But why? Because of the accessibility barriers. But DPC did the humanitarian work and rescued this woman. So just imagine if such efforts wouldn't be taken. Would the life of this mother be secure? The answer is no. Then also look at the other challenge that we also have, the quality of the care that the health care that we get. It's not so that convincing, because when you look at the continuity of care, patients not often, they are not seeing it. Today you get there, they do the test of malaria, they tell you there is no medicine. Or they do the test of typhoid, they tell there is no medicine. So you can just imagine, and this demoralizes people to also have belief that here they will get some good care when they go to these health centers. And it's a very big challenge because some are not getting what they expect from there, because when you look at malaria, typhoid, infection, these are UTI, these are some things that we believe that these health units would be offering to our community. Then also look at the other challenge that we also have is the shortage of essential medicines and lack of equipment, like as my colleague also just said about it. Also see that they don't have some essential equipment. When you get even to Mbale Referral Hospital, which is at least a higher rank than these other lower facilities, you may find that when you want to do some certain tests, they recommend you to go for private testing, which requires money. And yet, most times, by the time someone gets into referral or to these governmental facilities, possibilities are why that this may not be having capacity or money to go for private treatment. So, but they are forced to go and do the test outside, then they come back. That's why you may find that someone has been on bed for like 2, 3, 4 days. They have told him to go and do a test or a scan, but because he can't afford the money, they get back to village to mobilize money or sell something before they get back to have the tests done. And this is a very big challenge because once these tests are not done, they are not given any medical attention. They are just there on the bed for 2, 3, 4 days without any concern or treatment given to them until they produce the tests that have been given to them. So now when you get into such an era, you want and ask yourself what's now the relevance of the PHC. And then the other thing that I also look at as a problem, we have also the financial, the lack of equipment. As I've just said, some health facilities are there at a level of health center for, but they cannot have the machines. When you even just go to measure like diabetes, pressure, you get into it, they tell you, we don't have this machine. But what's the cost of a diabetic machine really to a health center to read? What does it take to have a machine of certain minor things that you feel government can be in a position to do? So it's on.
Mr. Nasul, if you allow me, look, you are a mayor, you were a leader in that community, and I know there are a couple of many other leaders in that community. What is that leadership doing to make sure what you are talking about in terms of lack of the equipment you talk about, recruitment, and many of the other requirements you talk about, and many you've not talked about, that we can have them in place for the people of Mbale? What is the plan for the people of Mbale from the leadership? Yes, Nasul.
Yes, when you look at our plans, the fact is we plan, but the implementation still becomes a challenge. Why? Government has taken over most of our powers that have been centralized. Look at even the issue of recruitment. It is true we do the recruitment process, but we operate on the wage bill, which wage bill is given to us by Minister of Public Service and Minister of Finance. So at the end of the day, for example, we have just run an advert there in Mbale district where we are only recruiting 7 nurses and 7 midwifery. But the health centers that we have even are more than 10. So just imagine the ratio of the population, the health centers themselves, and the people that we are recruiting. But why? It's because of the wage that we have cannot accommodate. So now as leaders, the first thing that we look at, we need to enhance to increase the funding. But this funding in our budget, it's not only in our budget, but even the centers also do the same. So that's what we are trying as leaders. Then the other thing that we're also looking at is to make accountability and monitoring. Because when you look at the challenge that we have sometimes, these health facilities have accommodation for staff, but some people take them lightly and don't be in this staff. When you get there by 10 or 11, you don't find any worker. So that means that now that calls a responsibility of I and other stakeholders to do monitoring and see are these nurses there on station when there is need for their service as far as night hours are concerned, can we get it? Then also need to review some policy and governance reforms in that we come up with a policy that really favors every person to have quality service from our health centers. Then maybe doing also community engagement. We talked about the VHTs, but the fact is, as my colleague of Kampala was talking about the VHTs, there are certainly people who don't know the VHTs as far as they are concerned, except in rural areas where people at least have seen their value and they have seen what they are doing. So we have to also question the policy to make sure that all places are favored and they have something. Then that also we are also trying to do as leaders, we're also looking at the supply chain management. In that if I have 2 area centers, for instance, in my division or in Mbale State, I should look at the population in these areas. Then where there are more people, we should have more manpower in that particular area compared to this side where there are few people. Because sometimes we may get into a facility which has fewer people, but again with more human resource. Then you wonder the criteria that the DHO has used. So as now leaders, we have to call on the CHO, whom I refer to the state health officer. I tell him what's the criteria here as far as the deployment is concerned. Then we also improve on it.
Should we conclude now that the leadership of Mbale City, through the office of the mayor and all the other responsible offices, are trying to make this follow-up in that community so that people are getting able to get at least the basic services in terms of health care in that particular part of the country?
Yeah, exactly. We are trying to do so, but this is cannot say that it is fully done because this calls for collective efforts and the collaborative means. Because there are certain things that we
Thank
are
you.
trying to push.
Thank you so much, Mr. Nasulu, and I'll pick more from you a little later, but that's very important if we're having that come out from Mbale, and hopefully other places and leaders can pick from that effort to make sure people are able to get the basic of what they need to live well and a happy life. I want to come back to you, Brenda. I know you might want to respond to some of the comments that have been made about the healthcare system, where there are shortfalls and where there is improvement and where people are appreciative. But also, I want to hear your thoughts on one, when you talk about all these initiatives that have been put in place, how are the people responding to them? And in any case, what should be the response and what is the role of citizens in making sure these systems that are put together by the ministry are actually efficient and functional in these communities? Yes, Brenda. And maybe before you come in, again, I want to request you all, whoever is able to have their video on, if it's not inconveniencing any of your in your environment to have it on, please let us have it on. It's very important for the conversation. Thank you so much. Yes, Brenda. Yes, please.
Thank you
Thank
so
you.
much. Yes, before I get to the question that was around the role of the citizens, let me also try to speak to some of the concerns that have been raised. Of course,
Please.
appreciating that it really feels nice when you have both the technical and political arms speaking to something, it almost similar things that they appreciate. First of all, the pain of the health sector, what the health sector is going through, but also they know their clear roles when it comes to creating a clear and good primary health care system for the country. When Dr. Chris spoke to the heart patient, I remembered that I forgot to make mention that we have also specialized hospitals now in Uganda. So it will be very hard to find a heart patient, very critical heart patient in an OPD. Definitely, we have a heart institute, and we have a heart institute, we have a cancer institute, we have a women's hospital, and so they handle specialties. That's how far we've gone as a country. But also, when you look at it's also a pain, and it would have been our wish to have people prioritize going to lower health facilities for simple medical conditions. Of course, there's no simple medical condition, but for conditions that can be managed at different levels. But of course, we are here to serve Ugandans, and we know the pain of Ugandans. So it would be very hard for someone who is there to serve to tell someone, get out of Mulago, go to Chitevi Health Center for a malaria treatment or a malaria test. And someone lives around Mulago. It will be very unfair. And if we ever do that, I'm very sure I will not be able to please Ugandans. And so the best that we can do, the best that the health sector can do is to accommodate those. That those who are around Mulago, if they walk in Mulago with a child with malaria, let them be managed, even if it's a national referral hospital. And so you find they have an OPD clinic that manages also those simple cases. For that one reason is that we are to serve, basically. And the population may not be able to maybe see it in that lens that we are seeing it as medical officers. But also at the same time, it's like we are trying our level best. And the health sector is trying their level best to upgrade these lower health facilities, to equip. That's why we are talking about state-of-art facilities at regional level, at district level, at health center 3s, to attract more people to visit and utilize those facilities close to them, so that we leave space for the national referral hospitals, for regional referral hospitals, for patients that need that referral or those services at that level. But we shall continue until when the population actually picks the concept, and then we ride on the same line. And then the other concern was around the patient Dr. Ratio, and then the supplies, the budget. Of course, I would wish to say this, that we have, every facility has a norm as per the policy that was passed by the lawmakers. And there's a number of people that is expected to be managed within a facility. But you know, increasingly, a facility that was meant to manage to have 500 bed space, now all of a sudden is having almost 3,000 people building, 2,000 people who need the same bed space. And of course, appreciating that facilities are made to handle cases that get out of the safety net. Appreciating that they are supposed to handle cases that are only supposed to be in the facility, mothers delivering in the facility. But when you see the way the health status has revolved, the demographics of the health status of the country, we are seeing 75% of the diseases that are in the facilities as diseases that can be prevented within our household. And so the 75% of those diseases that can be prevented by you eating well, not sleeping with animals, by you sleeping under a mosquito net, by you cleaning your toilet, they are the same diseases that are flooding the health facility. And so, for example, on an annual basis, we get 33 million contacts at the facility. We have 46 million Ugandans, right? 33 million contacts. And those are the many millions that are managed in the facility in an annual basis. And so the assumption would be that even when the staffing norm and the doctors and the space is only met for 500 people, you cannot get up and people have come and you tell them leave. You can only manage 500. But what the health system and what the health workers are trying is to do their best that let us use what we have. And so you'll find that even when the budget they give, we try to break it so that we can have at least the basic, is that when someone comes, you manage with what you have, even when you don't have the exploited, they are finished. You still have to help this Ugandan who has come. And so you try to see what you can. Those who can be on the bed, okay. Those who can sleep down, okay, but let us save life first. And then the issues of the norms, we shall go on forums and advocate later. So even when you go back to the communities, if only we let Ugandans appreciate it in that angle. Me as a technical person, they will understand why the nurse gets overwhelmed and people sometimes complain because there's some little bit of delay. They will understand why you find some patients on the bed and others on the floor. They will understand why sometimes you go in the facility and they say, okay, let us help you, but can you please go and help us get this drug, or can you go and get this test? It's because the demand has surpassed the supply. So I thought it's very important also speak it in that angle.
Yeah,
so
thank you so much.
Yes, and then the issues of I think that also the population and the funding. You know, at least I liked it when the mayor spoke about the wage bill. And of course, year in, year out, our prayer has always been, can we have some little bit of increase in funding for the health sector? Of course, we know, and all the things that we are discussing, they all rotate around funding. The health sector can only use as much as it's given. If they give you 8% of the national budget, you're supposed to divide that to meet all the needs of the health sector. And so what you can only do as much as what the funding that you have can do. So if you can also advocate, that would be nice for all of us, for people who also for us, the service providers. So when we talk about the role of the citizens, going back to oh, sorry, my computer is playing that. Going back to the fact that health starts at home, and that's what the health sector is. that unless citizens appreciate that the facilities are made to only help in situations where you really need it, but the majority of the health is created by the citizens. We want the service providers to move at the same level with the citizens. We want all of us to be able to play our roles properly, okay? Because we appreciate that if I wake up one day and I prevent a disease, okay? Because health is, I remember that whatever that the Ministry of Health used to have those days, that health is made at home and repaired in the facility. So the number one role of the communities is to make health. The research shows that 94% of human beings are born healthy. It's only the 6% that is born with some congenital activity, congenital abnormalities, but the rest are born healthy. But as we grow, our lifestyle exposes us to diseases that actually make us unhealthy. So majority of you can say me and you who are absolutely normal, we're born healthy. And all these diseases that we have been created because of the way we choose to run our health. So as citizens, we want to do one thing. If the health sector has really prioritized, and they say we are bringing a malaria vaccine. For us, what we want from you is to just give us the children for immunization. If the health sector is telling you there's an outbreak of Ebola and monkeypox, please wash your hands. What we need from the citizens is to just wash their hands. If the health sector is saying or telling us, okay, we have limited supply for medicines for diarrhea, what we need the citizens and the leaders is to just make sure that every household has a toilet. Every household eats clean food, and that's the role of the citizens. And then if someone gets sick, what the health sector wants is for you, if you have a sick child who is at home, you do one thing, take the child to the facility at the earliest time possible, so that we'll avoid situations where you sit with a child who is sick at home, and then the child gets critical, and you run to the facility. At the entering the facility, the child passes on, and then who takes the blame? Is the health system. And of course, now it's even worse for the health sector that we have social media, that whatever makes news makes news. When they talk about women are dying, children are dying, one day I asked someone, do you know how many people enter Mulago on a daily? They said, no, they are in thousands. Then I told her, do you know the gate that comes out of the mortuary? Have you ever seen found a queue of ambulances getting out of that gate with many dead bodies? He said, no, you rarely see a car. You only see one or two once in a while. Then I told them, okay, just know that the majority of people who enter that facility get out when they've been treated and they are well and they go home. So just that one person who unfortunately gets out of that net is the person that media picks, okay? But you've never seen any ambulances. On the village, they don't call you every day that someone has died because the health sector is doing their job, okay? And so—
Thank you so much.
Yes. And so what we need from the people is that do your part to prevent diseases, seek health services early. If you see any abnormalities in your community, if you see any abnormal deaths, any abnormal diseases, animals dying, just let the nearest facility know. They will be able to come out. Even if it's one Ebola case, the whole facility will come in big arms because we know how difficult and how bad Ebola will be if it's spread to one person or another. That's the citizen do us there that. Don't throw rubbish on the street, okay? Immunize your children. If we give you a mosquito net, just sleep in it, that you don't get malaria. Because when you get malaria, you again blame the health sector. If they've done their part, they've bought the mosquito net, they've walked door to door for 47 million Ugandans. given the mosquito net, you're not sleeping in it. Now what can it do? So
Thank you so much, Brenda. And I know the citizens out there are very much hearing your call, and certainly they'll have to respond to all those recommendations you give them. Do not throw rubbish, sleep in the mosquito net, wash your hands, have a toilet, and many of those other things that they have to do to make sure they are living in a healthy way and prevent some of these diseases that you say are flooding our health sector. Good luck. You see, we talk about all these challenges that are present in the community, but it's important here at Civic Space when we talk about the solutions. So how do we get out of some of the continuing challenges that are prevalent in the communities so that the community now can say we have a standard primary healthcare system? Yes, good luck.
Thank you very much. I think, for example, the doctor whom we have on this call with us is that he's in the private sector, and I can tell you, so far the statistics show we have, I think, more than 7,000 health facilities in the country. Government has slightly more, 4,000. The other 3,000, and most especially these are dotted in the cities we have. And so one of the solutions is that, for example, under community health, what Brenda Nakanwangi is saying is that they are really, really trying to go at the communities to make sure they stop some of the diseases out there. But also remember, we have the last statistics I saw, there's a time we were producing like 1.6 children million per year, but it seems now we have gone past 2.5 children per year being produced. And if we cross over to 3 million per year, that means we must really look at the investment in terms of the money. We have seen the donors are cutting, and therefore I agree with everyone, the mayor and everyone, that we must talk to our members of parliament. And I hope one day you will really also help us talk to some of these people. So we are even in the budgeting process to ask why can't they stand on the tables and bang tables like we hear, but at least we maybe go to 10%. Because if parliament does not, because most times you hear people, complaining here and there, but if parliament does not release the money, these other people in the sector, they can only look, they have good hearts, but they have where they can stop in terms of so resources, critical infrastructure. We need much more. The other time I was near Lake Bisinia, that is in Katapi. I was at a health center too. It is 60 kilometers away from Katapi General Hospital. In between there, they have a health center 4 and 3, but I can assure you, if things are not working out, so for me, resources, infrastructure, and also appreciating these people. And like Shan said, if they produce 1,000 children at a health facility, and if one person gets a problem, and maybe we demonize these people, sometimes we are also being like our enemies. So lastly, I would also appeal to this, that to those who are able to donate some money. For example, let me give you this example. If you got let's start with 500,000 shillings.
Good luck. Kindly, can you be a bit louder, please?
If you got 500,000 shillings, that would be 100 liters of fuel for an ambulance in your locality. If you put that money at a health center, maybe it could help. But if you put 5 million to those who are able, it could be 1,000 liters. 50 million, it could get us 10,000 liters. And we are seeing people with money, but because for some reasons the health sector does not maybe come to appeal, I really am trying to do something around that. That as a person, if you can donate a machine that measures blood pressure for your health center, it helps because, you know, even to those who travel mostly around this country, you never know where you find a challenge and you need a health facility near. For me, I think the solutions are with us, but thank you, Civic TV, for at least every 3 months or something, you try to bring in health matters. But I wish they can also be monthly, but also try to bring for us members of parliament. These are the people who have the money. They are the people who decide what is given. And therefore, for you, that's where the solution. And as you go for campaigns, to those who are listening to us, make sure you note what people are promising, so that you also keep reminding them. But this saying where things have failed, things fail when you are doing something. As when they are pushing it, at least the car is failing, but you are putting a hand. Not when you are standing somewhere, they are failing to push. No, we all have a stake. And me, as I go around the country, I can see there is some hope somewhere, but the system, the health sector needs much more money. So that people like Brenda and all the others, even the doctors in the private sector, they can work. Lastly, there is what they call local maternity and neonatal systems. There are over 20,000 medical workers who are volunteering every day to oversee what is happening in different regions. And for example, in Mbale under Bugisu, I don't know whether the deputy mayor is in the local maternity and neonatal system of the area, because if you are part, you see how people are going beyond what we are paying them to make sure that even in the night they are looking for blood, they are looking for ambulances, they are waiting for people who have had issues. But it all takes also leaders. If leaders, for example, you at Mbale Regional Referral Hospital, they are building for you a call and dispatch call center for ambulances. But I was with the people who were visiting. The leaders were not there. The leaders are not supervising. People in the hospital are like, they don't care. This is like not their project. So it also starts with when the local leaders really rise up to the challenge and say, whatever little we have is ours. What can we add? The last time there was they were giving money to health centers in Mbale, in Mbale city. I don't know which division, but there's a sector which got RBF of 160 million per quarter. But they were in the media saying they can't buy a bed, they can't add a bed for delivery, which costs around 15 to 20. And all this money was being, of course, the money was there to motivate them, but it also had the component that when you have challenges of equipment, put some money to equipment. And therefore, for me, I think the leaders, but it also starts with us when we keep reminding them, especially the promises. And this election, I hope to come to Mbale and I hear the new leaders, the mayor and his team, what they'll be promising us. Thank you very much.
Thank you so much, Goodluck, for that. And Dr. Christian, yes, how do we move forward from where we are to a better and indeed the best system we can have in our country, Uganda? Yes, Doctor.
Yes, thank you very much again. So how can we move better? Number one, let me start with the citizens down there. We're having various cases and reports of corruption. Sorry for that. Let's turn my video. Hope you're with me right now, Muliisa.
Yes, I have you.
Okay. So our citizens down there, we're having various cases of and reports of corruption among external health workers too. But then how do we mitigate this? It starts with us, it starts with you and I. If you're finding out you're going to a government facility, you know you're coming for free services, the Ministry of Health has done its work, putting up labels. I've seen various labels even in local languages saying, it's free services, don't give anyone cash. Regardless of if it's a statement of good practice, please refrain from that, because this is what motivates other people to set up corruption. So if Philip, you come to me and you give me a stipend of good, maybe good care to you, and someone else comes in and doesn't give out to me the same stipend, of course, there is a way it evolves into my mind over time. I'm getting used to this stipend. So every time I don't get the stipend, I don't give quality patient care. So please, people down there, stop doing this to health workers, most under government facilities. 2, now let me move to our government. Our government should improve on the funding into the health ministry. So raise this amount from 7.7% to at least a sustainable percentage. Right now, if agreed upon a 15% to be given into the health department, at least try to make it to 10%, raise it. Because you're having the same issues all over. Wages are few, health workers are few, essential medicines are out of stock, but you can deal with this by raising just this amount of money allocated to the ministry. Then to the citizens out there, if you're finding out you're going to maybe health center 12, center 3, I happen to work in Champisi. I like some health center put down there. So I like the way they do that thing. I talked to the in-charge, she was like, we get some days off, we pass through the communities and they agree to help out the facility to do slash around the compound. So if citizens can do that, you're saying something's not right to your facility, you can come up as a community and help out with the administration. At times funds are not available, but you can help out. So let us do a stakeholders thing, let us help each other into that. As the government tries to lose for money to give to us, we can also help ourselves out. I like that, was it Mr. Goodluck who talked about donations, certainly partnerships. If a community can come up and be like, we can help our facility by maybe buying BP machine, like you said, let us do that. This is something not supposed to be. If it's 100,000 a good machine, you can do solicit money from you people to help out with service delivery to yourselves. That will help a better system for us. The other thing can be, so we need workforce to be retained in our country. We are having good medical officers fleeing out of the country. Why? Limited or low wages. If we can work upon the wages of our medical workers and retain them within the country, I believe we can be a better country when it comes to our PHC system. I talked about VHTs, and I like Madam Brenda, she kept on talking about VHTs to an extent and preventative measures. Yes, it starts with citizens sleep under mosquito net. We had these things during our primary schools, for those who went to primary schools, how to control maybe mosquitoes. It says slash bushes around, remove stagnated water, spray, all those. But if we need more sensitizations, people know them, but at times they ignore them. So let us empower our VHTs, let us give them more tools, let them go back to ground. If possible, you can even put up an advanced health worker to move around with them. Let them keep on sensitizing our communities to prevent such diseases, to help our system a lot.
Yes, thank you so much, Doctor, for that. And I know many of those will be heard and picked up wherever they have to be picked up. And certainly we see them getting implemented in our system so that we improve it. Mayor, moving forward in Mbale and making things better, how do you see us moving? And I know we are heading into an election. Is Mbale prepared to bring leaders that are going to be ready to monitor the projects like the Goodluck was telling us, make sure if the money comes, you budget well and we move forward in improving the lives of people in Mbale? Yes, Mayor, quite briefly.
Thank you, Mr. Phillip and all colleagues. It is the question is a bit tricky and technical because the political base of Uganda has been so much commercialized in that we can have a leader who is transformative and able to do it, but then the financial position does not make it. But however, as colleagues have just emphasized, is to first own this project, that it is a responsibility of all of us. And how should this be? It is my responsibility, the current that today, such that tomorrow is seen better. So for us, what we are trying to do, and that what we need to still do, is to make the active participation in health planning and monitoring. That let each and every person be part and partial of the planning and participation in this health service. And we're also trying to promote health awareness and health education, in that whenever there is any platform, we are telling upon what should be done. I can just give an example of the previous Ebola that was hitting Mbale, which I'm sure all colleagues were aware. We continue to tell people what is happening and kept on giving updates. And in less than a month, the situation had been normalized. So now what for us we are trying to do is that we are mobilizing resources. Like I have an example of a hospital in Mbale State here called the Bufumbere Center 4. The community has kept on buying land, and this hospital is growing bigger day and day. But why? Because we're mobilizing our local resources from able people, from good people around, well wishers, and the government is getting us on the road. That means that people have understood that this thing is ours. Government will get us on it. Then what I'm also trying to do is that we are trying to have behavior change, that let people have their mindset also channeled to what we are looking for. Let them not only think they are helping government, but yet they are the prime people in this case. In that, as Dr. Brenda said, Madam Brenda said, government has given units, government has provided you medication. Again, you need to follow up to your home to tell you how to utilize it after being given. These pregnant mothers, once you have been told during the maternal care time, implement what you have learned and what you have been told. So we are trying to implement all that and foster in collaboration and partnership. We have gotten NGOs now, like there's a area center for area center 3 in Namakwekwe center 3 in Mbale Northern State Division. Find that we have gotten over different NGOs that have also for us a shed for pregnant mothers. They have also established for us a toilet and some other things. So as we have these partnership organizations, they are coming up to ease the would be other burdens onto government. Now we have staff, support staff. They are called G2G. Then we have those that are also in other organizations, like the American embassy is also facilitating them to give the care services. So we still now have to look for more and more of that. As we wait for government to increase the funding, these NGOs are also helping us to reduce the burden. So now in the coming election, as I summarize, this is now upon the people to see that I, Deputy Mayor, what have I done in terms of mobilization and in terms of achieving the objective of good health. So if they see the value, that's how we shall move. But the prediction of which leaders are they going to have, actually this one now gets back onto community itself to assess and see how best have we done in this term and where are we heading or compared to where we were before and where we are now.
Thank you, Mr. Wachi Nasulu. Well, to you, our viewers, you have heard the thoughts, the views, and the facts from my very eminent panel here, and it's certainly upon you to pick up most of these views and implement them, but also to the leaders. I know we have many of our leaders in parliament, in cabinet, and in local governments that keep following these conversations, and they keep asking more questions as follow-ups. Please, you hear the concerns from the technical people, from the politicians, and everyone. Let's make sure we keep picking up these ideas and see that we improve our systems. I don't know, Mr. Nasulu, you had something very 30 seconds, please.
Okay, thank you, Mr. Phillip. What are they left out, and I feel it's very important. When you're talking about the issue of accountability, we want to make every person to be partial and responsible for this. I'm saying we are trying to talk about the MPs and other stakeholders, but what I want us to all have is that let's all own this responsibility. That even the LC1 in his area, the VHT in her area or his area, has an accountability to make as far as the PHC is concerned, and even that person in his own home. So let's evaluate also beginning from family as we go upward, or we begin from the top to the bottom, but you find that every one of us shares a responsibility towards having quality PHC. And at the end of the day, once we all accept that we are a key stakeholder in this, then we shall have quality services and domination shall be by all of us.
Thank you so much, Mr. Wachi Nasulu, and I think it's very important that I give at least 30 seconds to the other speakers to just say goodbye to our viewers, and we can come to the end of the conversation. I'll start with you, Dr. Christian.
Yes, thank you very much again, Philip. But thank our viewers for giving us attention today. And let's work hand in hand to achieve our objective of accessible, affordable, and equitable PHC to us all. Thank you very much.
Thank you so much, Dr. Musana. And last word from Brenda. Brenda, what's your final word?
Thank you so much, Phil. And I also appreciate our viewers for loving their health first and for loving their families and everyone. And I still encourage them that health starts with them and it ends with them. The health sector is just there to support, but the effect of health is still back to them. So keeping healthy is wealthy, health is wealth, and so keeping healthy is very priority and key. Thank you.
Thank you so much, Brenda Nakanwangi. Brenda is a Senior Programs Officer in the Community Health Department at the Ministry of Health, Uganda. Thank you so much for your time and the thoughts you've shared with us here, and we appreciate them so much. Dr. Christian Musana from the Center for Relief Aid and Development, but also medical doctor at BIONET Medical Center. Thank you so much for your views and for the time you've made for the conversation. Goodluck Jonathan, a journalist from the Rwenzori region, and is key in the reporting about health. Thank you so much for your views and the thoughts and the time you've spared to her to be here on the conversation. And lastly, Mr. Wachi Nasulu, Deputy Mayor, Northern Division, Mbale City. Thank you so much for your thoughts and for making time to the conversation. We appreciate you so much. And to you, our viewers, thank you so much for keeping it Community Voices and Civic Space TV here. We appreciate you so much. Special thanks to the Taken, special thanks to the Center for Constitutional Governance and all our other partners for making sure this keeps happening and we keep putting that voice to make sure we make our community, our country, our region better and the best. I am Phillip, Muliisa, and I shall see you next time.